Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been performing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992. That's all I do. I just perform cosmetic or aesthetic plastic surgery. I perform a lot of facelifts. My most favorite procedure, very commonly I'll perform 3 to 4 a week. And I love it because patients love the results, and I think it's a very artistic endeavor for me. A common question is that, people put the time investment in, they put their financial investment in, and they don't want to mess anything up, so they want to know, Dr. Shapiro, what should I avoid after a facelift? What kind of things can I do? I think the first thing to understand is it's a normal process to have swelling and variable bruising after a facelift. After around 10 days, the stitches come out, and you can start liberalizing your activities. But seriously, within that first 10 days or so, we like you sleeping with a pillow, with very, very few pillows, and just a rolled towel behind your neck to cause the nose to go up and decrease any flexion along the neck. Now, why do we do that? Because it helps the scars behind the ear heal very, very well. We also like you to minimize the amount of motion that you have in your neck and move your whole shoulders if you're moving your head within the first 10 days. After that 10-day time when all the sutures are out, I think you can start resuming more normal activities. I think very commonly I like to have patients do some walking within that first week, as long as you have a hat on and you don't have a lot of sun exposure. And that brings us to another point. You should really avoid direct sun exposure for the first month or two after a facelift, because that skin does not have the ability to react to the sun normally like it usually does. So it doesn't sunburn while it will burn. So we need to make sure you wear a hat and have sunscreen. Also, avoiding the sun is very important, because we do not want those incisions to hyperpigment or get red. So we commonly will have you use some scar cream after the stitches come out to put on twice a day, and some sunscreen to make sure that you don't have too much sun exposure there. Lastly, in terms of activity, we like you to kind of take it easy. For the first 10 days to 2 weeks, really no lifting at all. The reason being is that about 10 days is when the blood clots that help everything heal start to dissolve by your own body's enzymes, and there's an increased risk of bruising. That's also why we don't like you to strain too much when you're going to the bathroom. So anything that can cause your blood pressure to go up could theoretically cause bruising or bleeding, so we like you to avoid that. People start to get back into their more normal routine in terms of light impact aerobic exercise or very slight weightlifting in terms of about 3 weeks or so. Really not much more than that. I can usually see how you're progressing by your follow-up appointments, but the best way is just open communication. If there's any question, you always ask, so there should be nothing that's unanswered. The best way to figure it out is for the first couple of weeks, you want to take it slow, and after that, gradually will increase your more normal activity. Overall, I think it's a really, really great procedure. I think people are so happy, and we want to make sure that your post-operative course is very smooth with minimal pain and minimal bruising, and the best way is communication. Thank you.